Schools will reopen next week, and aside from primary 6 and secondaries 4 and 5, the rest will alternate between home and school-based studies on a weekly basis. Now, since children seem to be the least at risk, is such alternative weeks at school necessary? Yisen, what is the likelihood of a young child getting infected and passing the virus on?
Well, I must say that this is something very new to us. It's a very new virus, and I'm beginning to see some kind of conflicting informations. And I think therefore it is very important for us to have our own mechanisms to be able to monitor our own internal policy and our own internal strategies. I've seen reports mentioning that in fact children don't get very easily infected, and I also seen report that children can be equally infected. Although in the local situations, our local data did indicate that we have lower incidence of children with COVID-19. But nonetheless, I must say that we have to take precautions. We have to learn along the way as we learn how this new virus behave in a different population, different segment of the populations. And do learn in terms of the virus, how it could transmit among children and how that could affect the family. So I do feel that it is important for us to take a stepwise measure. For every step that we take, we learn from it and we adjust along the way till one day we know more about this virus and we know a better coping mechanism.
Right. Yik Ying, could I turn to you? Children may not catch the disease as easily as adults, but in an Asian family, there are very many 2 or 3 generation families. So the risk would be for the grandparents who may be living together. Do you see that as a potential risk for opening schools?
Well, I think that certainly will be a risk because, as Yisen has mentioned, we are still learning about what is the likelihood that children end up becoming the vector, meaning they are the one that carries the disease. They may have a very mild infection themselves, but they end up being the one that spreads the disease to people within the household. So when schools reopen, this is really where we come back to some of the risk assessment that David talked about, that we need to understand using the data that will come about as the schools reopen to really evaluate, is it as safe as we anticipate it to be? Because I think one fact is that low risk does not mean that there is zero risk. And what we have seen so far is that schools are putting in place the necessary measures for the reopening to minimize risk, not just to children, but also equally to the teachers, the staff in the school. And the alternate weeks of on-site studying that Salma, you talk about, it's bad news to some parents, but it is actually a very good way to stress test the system. And this is where you see we are allowing certain, about half the schools to go back first. And I think that parents have to understand the risk right now is actually no greater than the risk that Singapore faced back in the months of February and March when children were still attending classes. And if anything, actually the risk right now will be lower than back then because of all the understanding that the more that we understand the coronavirus, the more measures that we've put in place, including the use of face masks, potentially even face shields coming in.
So you're saying we're actually safer now than we were in March. Any advice to families where they have 3 generations living together? Like you said, when children go home, should they avoid their grandparents or things like that?
We have to learn along our way how we will socially interact with one another, family too. I just want to bring back this point in terms of what we have learned so far from the local epidemiology. We see family clusters. So, and this is one thing that I would like to stress, that we thought that while we interact outside of our home is unsafe. Do think ahead in terms of how we want to interact at home as well, especially at home. We have senior members in our own family.
Right, but you can't expect people to wear masks when they're at home. So what are the sort of precautions that they can take?
Well, the several advices had already came out from the ministry. One is for the senior citizens, first of all, take care of themselves, stay at home most of the time, so reduce the social interactions, reduce the number of social interactions. essentially is basically is risk assessment. So in other words, this is a virus that can transmit from human to human. So the less you have in terms of frequency of coming into contact with a huge number of human, you reduce your risk of transmission. I think this is something that we always have to bear in mind. Now, coming back to a family, it is unavoidable that we will come together as a family. Then it's important for us to bring back what would be the risk of transmissions in the family. So if we do have young children that potentially, attending school and the environments may not be safe, despite the fact that they do all the precautions, putting on their face mask, social distancing at school, if there is still a potential risk in that environment coming back to home, then we have to modify our own home environment to be able to reduce the risk. Now, coming back to risk assessment, it is not always to the fact that we can completely eliminate risk. I think that is not possible unless we bubble up ourselves and be the one isolating ourselves completely. And that is not something possible. And therefore, we have to do every steps to engineer into our own daily living how to reduce and minimize the risk.
Right. Thank you very much, Yi Sin.